Hi, and welcome to my presentation. My name is Gutama, and the title of my presentation is called Therapy and Counseling for Black Families. Before I start my presentation, I would like to go over the land and ancestral acknowledgement. I would like to start by honoring the land that we are on, which has been the site of human activity since the time immemorial. It is the traditional territories of the Huron-Wendat, Anishinaabe, the Chippewa, the Haudenosaunee Confederacy, and more recently the Mississaugas of the Credit River First Nations. Ontario is covered by 46 treaties and other agreements and is home to many Indigenous nations from across Turtle Island, including the Inuit and the Métis. These treaties and other agreements to peaceably share the care of the land and its resources. Other Indigenous nations, Europeans, and newcomers were invited into this covenant in the spirit of respect, peace, and friendship. We are all treaty people. Many of us have come here as settlers, immigrants, newcomers in this generation or generations past. We are mindful of the broken covenants, and we strive to make this right with the land and with each other. I would also like to acknowledge those of us who came from forcible and involuntary, particularly as a result of the transatlantic slave trade. And so I honor and pay tribute to the ancestors of African origin and descent. So this is a picture of what North America was like in the past, and it's called Turtle Island. So the agenda for today's presentation is to go over access to therapy and counseling services, to discuss the shortcomings working with Black families, and to talk about Black communities' misconceptions and stereotypes of what mental health is. Access to therapy and counseling. The high cost of therapy. It's no secret that accessing mental health therapy or counseling is very expensive. Therapy is a place where you go and get guidance. Unfortunately, there's so many people who are priced out. When you have an honest conversation about your race, you will understand that a personal social position is really determined in large part by the lottery of your birth, whereas having access to things is everything. A person does not get healed after one session, which means that the cost of therapy adds on with each session. Just like physical health, mental health needs to be a part of one's everyday lives. The COVID pandemic has exacerbated the cost of therapy. The second point, being dismissed or misdiagnosed due to racism. There's a large body of research that states Black people have a large mistrust in mental health professionals. The reason is because we as Black people experience being easily dismissed, our experience are being easily dismissed or misdiagnosed when seeking medical attention. Nobody wants to go to seek to help from a therapist when their symptoms or concerns get dismissed by their own family physician or a psychiatrist. The door for accessing therapy gets shut down right away by the physicians, whether it's due to racism or the stereotype that you can't even afford mental health therapy, so why bother to go through this process? Clinicians need to acknowledge the pain that exists for Black patients. This would increase the likelihood of more Black people willing to access therapy. Data suggests that Black youth are disproportionately diagnosed with disruptive disorders such as bipolar. One study suggests that Black youth are 2 to 3 times more likely to be diagnosed with stigmatizing diagnosis than the same age white youth. When these youth become adults, they are unlikely to pursue or trust their physicians. This is why I like this quote, "Be the change you want to see in the world," by Mahatma Gandhi, a civil rights activist. Shortcomings working with Black families. The impact of power differential between mental health service providers and clients. And biases that exist. For example, there's a perception of viewing Black youth as being rude, dangerous, or violent criminals. In general, biases are perpetuated by past experiences or enforced by images in the media. We all have biases, including healthcare professionals. Healthcare professionals sometimes might not be aware of it at the moment when they're trying to help people, but these biases are hidden inside of us all. Mental health service providers need to remember that just because they work in the healthcare field does not make them better than other people. Though mental health service providers' intention is to help their clients, but sometimes their biases are causing further harm and they might not have known that until a later date. Hopefully you, not a mental health service provider that doesn't believe that you have any biases. So let's figure out where our unconscious bias comes from. So this is an exercise that I'm hoping to go through with you all. So out of the 4 subway pictures, which one would you rather get into? Just take a mental note and then decide if it's picture 1, picture 2, picture 3 at the bottom, or picture 4 on the other bottom. So take a moment, just ask yourself, which train would you want to go? If you had the choice between one choice between these 4 trains, which one would you select that you would prefer going into? I'm assuming that most people would pick picture 1 because it has 4 people in the train. There are more chairs to sit down and less noise and distractions. I'm assuming you won't pick option 2 because you would feel unsafe being in a train with only one other person, especially since this person is behaving strangely inside the train. Some people may not pick option 3 or 4 because the train is very crowded. Or some might prefer to pictures 3 or 4 because of familiarity or the fact there's more witnesses to help you in case of an emergency. The point of this exercise is to outline that we should not just view biases based on race and discrimination. By participating in the exercise, we all provided answers from a place of unconscious bias. Unconscious biases exist in all of us and are necessary to keep us safe. True or false? Take a little time. The answer is true. Unconscious biases are often automatic responses designed to keep us safe from harm when dealing with potentially dangerous situations. Next question. What is the percentage of information processed unconsciously by the human brain through experience-based rules? Basically, like what is all those unconscious thoughts in your brain like? Do you think it's only less than 10% that it happens in your brain? Less than 50% of unconscious thoughts? More than 75%? More than 99% of the time you have these unconscious thoughts? Take some time before you choose your answer. The answer is more than 99%. The brain gets 11 million bits of information every minute and can deal with 40. At 11 million, it can only deal with 40. The remaining 99.99996% of information is processed unconsciously. It's pretty impressive. I like this quote as well. So we can only see a short distance ahead, but we can see plenty. There, the needs to be done. By Alan Turing. Working with the Black community. In the Black community, we still have misconceptions and stereotypes of what mental health is. Some people view them as places where only the mentally ill people go to. Others view it as an asylum, and you'll never come back home if you enter their mental health institutions. They will drug you up, and you will never be the same person again. This is some thoughts in the Black community regarding to mental health facilities. Working with the Black community. Mental health service providers need to understand their own implicit biases. Basically, what is your own cultural identity? Figure out how it shapes your worldview. Create space for the people that you work with to name their own identity. Value the input from the people that you are working with. Listen attentively to your clients. Remember to break a habit. Awareness is not enough. Take action against your own biases. So these are steps that you can improve your service when working with the Black community. And this is the end of the presentation. So I just want to say thank you for taking the time to sit down and listen to my presentation. Thank you very much. Have a great day.